I want to thank you all for coming out tonight, enjoying one of our few evenings where we don't have a lot of wind, we don't have a lot of bugs, and it's really nice out. So thanks for spending your time indoors with me. What I really wanted to focus on tonight, we're going to get to seasonal affective disorder, or the condition called SAD. I really wanted to talk about ways that we could enjoy this time of year versus dreading going into the winter or enduring the winter. So really trying to going beyond getting through this period that we're coming up with. And when I think about trying to, it's really rethink how we're personally thinking about the winter and about shorter daylight hours. And when I'm thinking about my thinking and monitoring for my thoughts, I particularly pay close attention to my word choice. So statements like getting through the winter or enduring the winter or how to make the winter more tolerable. Neither of those three phrases really sound pleasant. So what are some different words that we could potentially use? And that's what I would like to kind of start the talk out with. Winter can be a very enjoyable time of year. We have distinct changes in our seasons that we don't see other times of the year. I'm very thankful during the winter that we don't have mosquitoes. So focusing, mosquitoes, they're very small things, but they cause very large pests. So not having to put up with mosquitoes is one of the positive experiences for me. And then before I came over here to Ostara, I was in Fargo working at Sanford. And I lived there for almost 6 years, and I had to learn how to get through the winter in Fargo, because at very first it definitely was getting through the winter in Fargo. I felt like I had moved to the Antarctic space, and I found that I actually really enjoyed doing snowshoeing. And I was able to snowshoe. If any of you have ever been in North Dakota, it doesn't do trees, but there was a golf course that had some trees that I would go snowshoeing in. And I found that as a way, at first it was getting through, but then I actually looked forward to doing that activity because it's really hard to snowshoe in the dirt. So I found that activity that I was very thankful for, that I could find the winter time. Other recommendations that I was finding on the internet today, one that closely related to me, I enjoy cooking soups. However, I don't enjoy cooking soups when it's really hot out. That's just me. So cooking soups and stews in the winter time is enjoyable for me because I don't get overly hot in my kitchen because it's nice and cold outside. And if I'm experimenting with cooking, if I burn something, I can rapidly open the door and let the smoke out too. So there is that. I have had people tell me before, whether it's in clinic or I'm out and about, there's nothing enjoyable about the winter. There is absolutely nothing that I could enjoy. Okay? I'll take on that challenge. So if there's nothing about the winter that you could possibly enjoy, do you enjoy the other three seasons? Are there elements of spring, summer, and fall that you really enjoy? For a lot of people, spring and fall are two seasons that we very much enjoy in the Midwest. So does your enjoyment of those seasons, is that outweighed by your dislike for winter? And for many people who live in the Midwest, enjoyment of those seasons, well, okay, maybe winter can become tolerable because I have the benefits of those three seasons to look forward to, versus living down in Phoenix, Arizona, where there's mostly desert and hot and snakes and scorpions. There are benefits to living in Arizona, I will grant you, but I don't want to put up with snakes and scorpions year-round to have those benefits. So if we can't find, and this could really be applicable for whatever it is we're trying to endure or tolerate or getting through, if you can't find anything that you remotely like about that particular event or that particular stressor that you're going through, is there other ways to look at it? And I often start with word choice in the very beginning. And monitoring your own words, especially when we're thinking to ourselves in our own mind, is the very first place that we'll start. And once we're monitoring our own thoughts, when we then start to talk to other people, we'll start to pick up on our word choice as well, because we're monitoring internally. So when we say it out loud, it's like, oh, I could have phrased that differently probably. And by opening up that pathway in your mind of what are alternative ways to think about this, it opens up your mental space and helps you perform actually better cognitively, because it opens up a space for allowing versus closing down this space when we see things as negative. I hope that can make sense. So actually getting into more of the meat of today's matter, I wanted to review the major kind of framework that we get to go into these seasons. And we're really looking at the time changes. I'm still not sure why we have daylight savings time. I understand why it was made in the first place, like before electricity and farming and harvesting. I get that. We're a little bit beyond electricity, and we definitely have headlights on our combines, as evidenced by the deer running out into the highways more so when they're combining at night. So I don't necessarily understand the purpose of daylight savings time anymore, but here we are. When we are officially changing our time, it's the 2nd of November of this year. And at the 2nd of November, we're already experiencing those shorter daylight hours. I know this morning when I was getting ready to go to work around 7:30, it was still somewhat dark out. Like, this is definitely more noticeable than what I had previously paid attention to. So we do notice when the daylight hours start to become shorter. They are at their shortest during the winter solstice, which this year happens on December 19th. My niece's birthday is on December 19th, so I always like to joke with her that these are the darkest days that we are having. She does find it funny, don't worry. But I look forward to her birthday every year. So with the winter solstice, last year, my family and I, we also got a DQ blizzard cake to celebrate the winter solstice. So, you know, if you can ever incorporate the DQ cakes into your events, that can make it more pleasurable too. But with the winter solstice, that is literally the shortest day of the year. And then from December 19th up to March 9th is when we start experiencing longer and longer daylight hours. And when we are at winter solstice and it's pitch black at 4:30 at night, it really is difficult to start paying attention to the subtle differences where we have more daylight hours. Our brains and the way that we're literally programmed are more programmed to pick up on less daylight hours versus more daylight hours. So it can be difficult to pick up on those small positive improvements, if you will. The important part of the changes with the daylight hours has to do with our body. It's called circadian rhythm. And what circadian rhythm refers to is our body's ability to manage itself in a 24-hour period. And, you know, way back in the day, like hunter-gatherer society, they didn't have clocks, but they were able to get their things done during the daylight hours, and then during the darker hours, they would go into groups, they would have more protective huddles, and they would really monitor for safety. So at that point, throughout human history, evolutionarily, we really became a lot more sensitive to those darker hours because that meant a literal safety to us as a species. So we needed more people to help protect us, help provide for us in those darker hours. So evolutionarily, that's why we pick up more on the darker hours than we do the lighter hours. So our circadian rhythm refers to our biological programming for a 24-hour cycle, whether that's being awake, whether that's being asleep, what we do during the daylight hours, what we do during the night hours. For some people, you'll hear them refer to themselves as being a night owl. Some people really enjoy the early morning hours. That's just their body's natural clock on whether they wake up earlier or go to bed later. There are certainly different conditions that make it more difficult to sleep at night, so we can see a lot of different disruptions in the sleep cycle, and I'm very thankful for sleep medicine, so they can help me out with those different disorders. And one of the larger changes that we can see seasonally with mood changes is differences in our sleep and appetite, so we'll go into that a little bit further. The two different chemicals within the brain that play a large role for our circadian rhythm are serotonin and melatonin. They're not the only two that play a role into our circadian rhythm, but they're the larger two components. I'm sure most of you have heard of melatonin supplements or seen it available at Walmart or looking at different pharmacies while you're waiting to pick up your prescriptions. The idea of a melatonin supplement over the counter is to help prepare your body for sleep. The supplement doesn't make you more tired, it signals to your body to help prepare you for sleep. And there's a specific part of the brain that is responsible for producing melatonin and then for sending out that message to the other parts of the brain that, hey, we're ready to go to sleep. Serotonin, it's a very complicated molecule within the brain. It's a chemical messenger within the brain. Many of my medications work on it, but it's one of the more important roles in sleep-wake regulation. And what sleep-wake regulation means is this chemical is not only important for helping to go to sleep, but also promoting wakefulness and alertness during the day as well. And there's a specific area of the brain that also produces serotonin, and then that part of the brain communicates with other parts of the brain to help signal the circadian rhythm. So it's not just one part of the brain, but there's often multiple involved in these regulations. So I talked about my adventure with snowshoeing earlier. How I truly came about snowshoeing is I used to cross-country ski, then I broke my ankle in Fargo, and then I found snowshoeing, which is much easier on my ankle. But both ways, I really enjoyed getting through the winter. But the winter I broke my ankle was definitely getting through the winter and not really enjoying it that much. So additionally, finding some type of activity to enjoy and look forward to that's unique during the winter, we can also look at general activity. Getting out of the house, like a lot of us talk about cabin fever, come like February, March, I see that term thrown around a lot. So trying to get out of your house as much as possible. If you go to church, if you have a volunteer, if there's a new store opening in town, just really any reason to get out of the house. Of course, you don't have to go and spend money to these events, but just something to get you out of your house and something to get you out of like the routine or perhaps the slump that you get stuck in during the winter. When we go out and do activities, especially if they're different activities, our minds are very engaged in those interactions, especially if we're talking with other people, interacting with other people, even people watching, which is one of my favorite pastimes, especially if I go to malls. When we're people watching, even at that point, we're also socially engaged. If we're thinking back to that hunter-gatherer analogy that I made earlier, when it was darker hours and we needed that protection, it was really cemented within our development, like literally our DNA. It was really cemented in our DNA at that point that we need others to literally survive. And then we developed more complex social relationships that we are able to progress from a hunter-gatherer society to farming communities, and then to our really complex social relationships that allow us to have international relationships, international travels today. So the more physically active and the more socially active we are, the more stimulated our brains become, and we lower the potential for development of depression and then clinical depression as well. So any type of activity to get you out of the house, especially if it can involve any level of socialization, is very important. And I want to make a point that socialization doesn't have to include talking to other people. It could just be sitting around other people. A lot of my patients struggle with social anxiety, and they're like, oh my gosh, the fear of actually going out and talking to someone. You don't necessarily have to do that. We'd like for you to eventually get there, but you don't have to the very first go around. Just being around other people can stimulate that part of your brain. And many people do take vitamin D year-round, but vitamin D is something that is naturally produced when we're exposed to sunlight. We have really good sunlight exposure in the summer, but even then, because we're in the northern latitudes, we don't have enough sunlight to actually make adequate vitamin D levels. We can also get vitamin D from things like milk and different types of protein, but for many of us, we do have lower vitamin D levels, and that can be year-round. Especially in the winter, again, when we don't have as many daylight hours, we can see a decrease in vitamin D. So then supplementation with vitamin D, usually it's over the counter at the first start of it. Supplementation with that can be very beneficial. When we're starting on a supplement, it takes even longer than my traditional medications do. So it could be up to a few months before you start feeling better with vitamin D. That's in general. It's not necessarily everyone takes that long to respond to it. Some people respond to it faster. So vitamin D, if you ever go to Walmart or the pharmacies, there's a lot of different varieties of dosing for vitamin D. There's like 1,000 units, 5,000 units, 10,000 units, extra superpower. I found that one the other day and I was like, wonder what vitamin D's superpower would be. But the different doses available, it's like, crap, what do I choose from? That's where going to your primary care doctor, and we can do simple lab draws, but our primary care doctors, if you've established with one of them and that they've worked with you for a long enough time, they can also give you recommendations on what level to start with. And when it says units, that's how vitamin D is just measured. A lot of supplements are measured in milligrams, but with vitamin D, we typically refer to them as units. So that's just how it's measured. And in order to really benefit from the winter, we need to be proactive in our participation of these activities and trying to take like vitamin D beforehand, before we develop symptoms that would need my traditional prescription medications. And one of the things that patients talk a lot about is mood lights. Some people call them seasonal lighting. I was trying to be playful when I said mood lighting. It is interesting, like if you go on Amazon and you type in like seasonal affective disorder lights or SAD lights, you get all of these varieties, like you can change it to 15 different colors, or this one comes with a magnifying glass for crocheting, which is actually pretty cool. I knit, I can't figure out crocheting, but the magnifying glass is actually cool, as I need more glasses the older that I get. So that one's not too bad. But they have all these fancy ones that are all these different colors, and it's like, no, you just need a simple one. They're usually around 20 bucks. I have no financial ties to Amazon. That is just the widest selection that we currently have in our area. I was actually strolling at Walmart the other day, and I didn't find any mood lights there yet. They may get them in stock later. The important difference, if you are shopping for a mood light, it's looking at how powerful is the mood light. And the mood light, its ratings are either luxes or lumens. And that rating is important for how long you have to sit in front of the mood light, which is especially important for me. I can't sit still for longer than 20 minutes, even if I try very hard. So with the mood light at 10,000 luxes or lumens, that's the most common level that we've done research with. And we've proven this to be beneficial to help folks with seasonal changes. At 10,000 luxes or lumens, we need to use it for around 15 to 20 minutes in the morning. You don't really want to use it after noon, because then you accidentally interrupt your own sleep-wake cycle. So with the mood light, that's what we're trying to do, is to normalize your sleep-wake cycle, because we don't have the daylight hours outside to help us regulate that. So you usually want to use it in the morning, about 15 to 20 minutes. Do not look directly into it. That will damage your eyes over time. You want to look somewhat in the vicinity of it. So whether you're reading your morning newspaper, if you're drinking coffee, if you're doing your makeup, if you're doing your hair, whatever typical morning routine that you have, if you can incorporate the mood light into that routine, you're more likely to use it habitually or over time. And once you get in a habit, that's when it can be really helpful for you, because you're trying to be proactive in preventing like the clinical symptoms of seasonal affective disorder. And that's where we know mood lights can be the most helpful for patients. There's some evidence that it can help in the treatment of seasonal affective disorder, but it's best at using for the prevention of it. So this one doesn't involve having to go outside, tolerate the cold. It doesn't involve having to put up with other humans either. It's just you have to sit in front of the light for about 15 to 20 minutes. If you do accidentally,
Is it a special light or is it just a light?
So on Amazon, they'll want you to think that, oh, these different colors are beneficial for you. No, the research that we've done is with white or blue light. Personally, for my eyes, the blue one drives me absolutely nuts. It's like those blue LED headlights you can see at night, and my eyes don't like them. So it's either the white or the blue light, and how bright that light is the 10,000 luxes or lumens. If you would find one that has less than 10,000, you just have to sit in front of it longer. And at that point, it doesn't become tolerable for me any longer. So I always try and give advice that I would want to hear to my patients to make it more user-friendly. And incorporating it into a morning routine also makes it more user-friendly. It helps us establish a new habit when we previously didn't have that one before. So I think most of us in this area, I know I can see it too. We can all feel moments of sadness. We can all have moments of, I'm not really enjoying my time right now. So at what point do those moments become more concerning, where we may need to start talking with professionals? And it's at the point, it's a cluster of symptoms. And that cluster of symptoms is what we refer to as seasonal affective disorder. And it has a lot of similarities to a clinical depression. As physicians, when we start talking about clinical depression, we're talking also about a cluster of symptoms, and it has to do with the duration of time during the day, and then how many days you're experiencing those symptoms. So that really differs between feeling low and sad for a few hours per day, every few times per month, to every day I'm feeling this way. So we often have patients very much monitor how they are feeling. It's important for us to know, hey doc, I'm feeling more sad, I'm not really feeling like myself. It's important for us to know that, so then we can help track those changes as well. There's different mood apps available on your phone. You can also make short notes on your phone or short notes on your calendar, just mood is lower today, not really enjoying myself today. It's just simple notes like that to help keep track of, am I feeling this way a lot of the time or just some of the time? And it can be very helpful for us. The difference between seasonal affective disorder and a major depressive disorder, which is what we call clinical depression, is the time of year that we're experiencing these symptoms. So a seasonal affective disorder, we can actually see changes in the summer too. Characteristically, we usually see more of these changes in the winter, but it's the time of year that we're experiencing these. With seasonal affective disorder, we see the changes about 3 to 4 months of the year in our usual winter months. Winter seems to have, all of the seasons have seemed to shift lately, and so the 3 to 4 months that we used to say for seasonal affective disorder have shifted a little bit, but it's truly the more winter months that we're seeing these symptoms. And then the rest of the year you're feeling fine. On the other hand, if we're looking at clinical depression or major depressive disorder, patients usually have these symptoms more than just 3 months out of the year. When we're treating them actively with medications and psychotherapy, we hope to decrease their time of experiencing the symptoms, but it's more year-round than seasonal affective disorder, where it's just isolated to the winter or to the spring. So getting into the meat, what actually symptoms are we talking about when we're looking at these clusters? And these are the big ones. These are the big changes that we're looking at. But then there's specific feelings and emotions that I'll go through with as well. With the mood changes, we usually see a lower mood, feeling sad, feeling low, feeling empty for most of the day, for about 2 weeks or more throughout the month. And it's at that time frame for most of the day, every day for 2 weeks, that we're entering the seasonal affective disorder, and we're also monitoring for clinical depression as well. The other important piece when we're looking at diagnosis is a symptom called anhedonia. And what anhedonia refers to is you're not getting enjoyment out of life like you used to, whether it's your hobbies, interacting with family. If you used to be a social person, now you're more isolating. It refers to not getting the same enjoyment out of your life as what you previously were. And that's also occurring for most of the day, every day, for at least 2 weeks. And you don't have to have a low mood. If you just have anhedonia, we are also concerned. And if you just have low mood without the anhedonia, we're also concerned. So they're not exclusive. You don't have to have both when a physician is talking with you about these different symptom clusters. We can also see memory changes. Oftentimes, patients will start really noticing short-term memory changes, ability to recall names, dates, information that they feel like their memory used to be really snappy with, They're like, man, it feels like it's more harder to get that information out of my brain. Those can all be common descriptions of how patients feel their memory changes. And with the seasonal affective disorder, and I found this interesting when I was reviewing the diagnosis, we see sleep changes and appetite changes, particularly unique to winter and then particularly unique to summer. And in the winter, we often can oversleep. If you think about hibernation, we can often oversleep. Again, not having as many daylight hours to promote more wakefulness with our brain. And then we can also have a tendency to overeat as well, particularly if we have cravings for carbohydrates. Can be a unique symptom of seasonal affective disorder. Carbohydrates are going to be like snacky foods. So thinking about my Snickers candy bar for one, chips, cakes, anything that really, really tastes good that can give us a sugar high, that's usually going to be from a carbohydrate. Different fruits are also considered carbohydrates, like an apple, for example. But when we're eating apples, it has more fiber in it, so we're not as likely to have that sugar high and then a sugar crash. So if you find yourself, you feel like you're eating more, especially craving more carbohydrates, changes in sleep, not really feeling like your mood's so great, time to talk to your doctor, and time to start really paying attention, how often am I actually feeling these symptoms? And very importantly, suicidal thoughts. If you are having suicidal thoughts, that is not a time constraint. There is no constraint on that one. If you're having suicidal thoughts, we want you to reach out. And when you're talking with your physician, talking with a loved one, the discussion regarding suicidal thoughts can be very scary. Often these thoughts are not something that we chronically experience. Some of my patients do experience chronic suicidal thoughts, and the conversation's a little bit different. But for many people, when suicidal thoughts come about, that is a very concerning symptom. So we want you to reach out and talk to us as providers. When we start talking about suicide with our patients, there's a range for suicidal thoughts, just like there's a range for managing blood pressure or managing like chest pain. A lot of patients, if they come in for chest pain, we worry about heart attacks. So when they come in for suicidal thoughts, we worry about suicide completions. So when we start talking about emotions and behaviors, it gets difficult to put them on a scale, like when we ask you pain, 0 being nothing, 10 being the worst. It gets really hard to put emotions and behaviors on that. So we try and relate to patients that this is a very concerning symptom. We are monitoring for severe medical complications like heart attacks and strokes. Suicide is just as serious as those conditions. It's a little bit more tricky to detect because it involves emotions, behaviors, and then sitting down and talking about very uncomfortable subjects. So when we start talking with patients, when we start asking questions about that, it's a spectrum. And on one end of the spectrum, we can have feelings of hopelessness, helplessness, and worthlessness. Any one of those can be considered a passive suicidal thought. Oftentimes, many patients are experiencing all three. And suicide as a behavior, it's complicated to study it. And there's this quality of perceived burdensomeness. So feeling that you're a burden or not worthwhile to our family and loved ones can be a very strong warning sign that more concerning suicidal thoughts are developing. So again, just like we're monitoring for heart attacks, we're monitoring for strokes, we're looking for symptoms or qualities of those thoughts to give us more warning signs. So there can be several questions when we first start talking about suicidal thoughts. And I always want to, it's not warn patients, but kind of give them an idea. It's a conversation that we have with our patients. Just because you express suicidal thoughts doesn't mean we're going to call the police and haul you into the ER. It's like any other serious medical complications. We're trying to judge how we can best help you in that moment. The other end of the spectrum, from feeling hopeless, helpless, worthless, is I have a plan, I have a thought, and I have an intent to go home and end my life, and I have some access to means, whether that means overdosing, whether that means hanging, whether that means a gunshot. I have access to these means to complete these very painful thoughts. At that point, please take your bone directly to the emergency department. If you feel unsafe to drive, that is when you're calling 911. We do have crisis lines available that do very good work. That number is 988, and you can either call or text. However, I would please, for the sake of me, because I always worry about my patients if I don't hear from them for a long time, and for me a long time is more than 4 weeks. If you do feel like you're having suicidal thoughts, please reach out. It is never a misuse of 911. It is never an inappropriate call to get the police involved, often like their first responders if we have to have like an ambulance involved or anything like that. So please, it's never a waste of resources. Please reach out if you're having suicidal thoughts, okay? I apologize for spending a little bit longer on that one, but suicide is something that's very important to me that I try and discuss with everyone that I give these talks to. So we talked about how with seasonal changes, we can see a lower mood, we can see changes in sleep, we can see overeating. If we're having that every once in a while, it's more of those preventative measures, getting out with the social activity, getting out with physical activity as we're able, of course, maybe using the mood light if we can afford one. So that's a preventative treatment. And once we get more into those consistent symptoms where we're seeing for like 2 weeks at a time or longer than that, we start entering the realm, it's called active treatment, or treating the disorder, treating the medical condition itself. And this really is a combination between medications and psychotherapy. Psychotherapy can also be called counseling. It can also be called behavioral health therapy. It's sitting down and talking with someone about the changes that you're going through, because we're trying to find perhaps activities that you can find enjoyment with. We're trying to see if loved ones could be beneficial and supportive for you. So in therapy, we're really exploring those other options in addition to medications. If you have to make a choice as far as affordability goes, if you're making a choice to treat seasonal affective disorder between therapy, counseling, and medications, I would encourage you to choose therapy and counseling, because if we have to choose one or the other, that therapy counseling is going to be more beneficial for you. When we start talking about prescription medications, it's my typical antidepressants. Those medications are going to be like Prozac, Lexapro, Celexa. Generic names are fluoxetine, escitalopram, and citalopram. They're common medications that many patients are prescribed, and we can see them being beneficial in seasonal affective disorder. With seasonal affective disorder, I am purposely not trying to say sad, because I'm not trying to associate those words with getting through the winter. So with seasonal affective disorder, our prescription medication is a bit different. With clinical depression, usually patients are on year-round. With seasonal affective disorder, we usually only start those medications for the 3 to 4 months, and then when spring comes around, patients usually feel better, so we withdraw the medications. So with seasonal affective disorder, it's not a medication that you have to be on year-round for a very long time. It's usually just shorter intervals. And we can see medications being effective at that shorter interval. The other part's vitamin D supplementation. Hopefully at this point, if we're looking at seasonal affective disorder, you're already on a supplement for vitamin D. We may need to increase it. We can do a repeat lab, see where your vitamin D levels are. There is vitamin D available underneath the tongue, and in some patients, they find it more beneficial, but usually if that's at a provider's recommendation, I wouldn't go out and buy the liquid form just yet. They are more expensive, so wait until your provider tells you to take that one so you can balance out the cost of that particular one. And then medications, I can't stress this one enough. With seasonal affective disorder and clinical depression as well, medications alone aren't enough. It sounds really nice just to be able to take a pill once per day and feel better. I wish that could be it, like antibiotics. We take those for 2 weeks and we feel better. I wish mental health was a little bit more simple like that. It's not. So we often need the combination between medications and psychotherapy, or medications and physical activity, social activity. All of those can be beneficial as well as the medication. So again, medications alone aren't enough. And these medications, if they are prescribed, they're covered under insurance programs. They've been out for, Prozac is the oldest one. It was released in the late 1990s, so they've been out a spell. and multiple of the other medications have been out as well. So many of them are available on the generic list, and they're affordable and covered by insurance programs. We talked about suicidal thoughts earlier. So this is a list for the resources. Again, if you're having those thoughts of wanting to be dead, a particular plan and intention, desire to follow through with that plan, that's when we're calling 911. That's when we're going to the emergency department. And similarly, if you're hearing those thoughts and those concerns from a loved one, those are the resources we utilize as well. Here's other resources. That 988 or texting 988 is the National Suicide Hotline. They redid the program like 2 years ago now, and they redid it really well. So if you call them or contact them, they can give you resources in that area. So let's say you're traveling, like if you go to Washington State and you're struggling more at that point, or your loved one is struggling more, if you call that number, they can give you resources in that area. So it's really useful if you're traveling. And then Minnesota Farm and Rural Healthline, that one is available as well. That one's more particularly unique to Minnesota. When I was over in North Dakota, I wasn't aware of a North Dakota Farm Hotline. So it's a particularly interesting resource because our anxiety and depression that we can have with farming can be a little bit unique. So having someone that those folks can relate to, I think, is very important for Minnesota.